This is one of the best tools, the Iceberg. It really comes from a lot of the work that was done in the process of moving from quality assurance to quality improvement. That is process improvement and healthcare improvement from a proactive perspective as opposed to looking at data retroactively and responding accordingly. The Iceberg is very simple. It literally says we need to get below the surface, below events, and into different ways of thinking about the problem that we see. As you see, if we're only looking at events, all we can do is react. In terms of patterns and trends, we ask the question, what's going on here? Have we seen this before? And then develop some methodologies to anticipate in an effort to avoid what we've seen before. Risk management is a good example in healthcare of this type of thinking and working to make changes for the future. The next level is systemic structures. And here what we're really looking at is what is the fundamental design of the system that we're operating in? And does it inadvertently create obstacles to the kind of change that we're really trying to pursue? So as a consequence, by looking at this level, we're attempting to create a new future. And that's a very important component, particularly in terms of healthcare reform. And when you look at WHO's and the EU's Health 2020 initiatives and those goals, it's very clear that when you get down to systemic structures, you've got a much better opportunity to have real impact. The bottom line, however, is that if we're really going to make a difference, if we're really going to break this cycle of behavior that we are constantly caught up in, we need to get down to the level of mental models. And that gives us an opportunity to really rethink what is it we see when we look at this entire system. And as we say, it's an opportunity to translate this comprehension, this new understanding of the system we're in, into really impactful outcomes. So if we take that at a very small unitary level of analysis, here's a good example of what we're talking about. In this case, this is involving an elderly patient and asking the question as we go through the process, what just happened? The elder patient has been taken to the hospital after hours of waiting, is admitted to the hospital for dehydration. The key here is dehydration, and what does that really mean? So the next question is, have we seen this before? Is there a pattern? And when you look at the patient's clinical record, you might see that as you dig deeper in the process, you will find that this has happened before, that there's been no routine visits, follow-up to these kinds of events. And so then the next question is, well, what's going on with the structure that prevents this patient from really receiving the right kind of attention? And you can see we've outlined a couple of key points that we think are important. The real issue, if you really want to make a difference, is to get to this idea of mental models. If we step back from the situation, what do we see about the systems of elders' care that inadvertently gets them caught in a cycle, which is a reinforcing event where they go to the ER, there's no proper follow-up care, and as a consequence, it's a repeat visit all the time, going on over and over again. So we need to change the whole system. Now let's take this to the next step. If you're thinking in terms of healthcare reform, how does the Iceberg help you make a difference? What we've done here is we've tried to outline some key points. First is to uncover the thinking behind any healthcare reform initiative. So before you really get into spending scarce resources for something, you want to step back and ask yourself, are we really getting at the root cause of the issue? What is the real problem and how do we attack it? Secondly, The iceberg is an opportunity to stimulate thinking for creativity and innovation, and not to assume that we have to use the traditional methodologies that we've used over and over again to solve these problems that are persistent. Um, they cause long-term impacts in terms of adverse consequences to the individuals affected, and it's costly to the whole system of care. The next question that really is important to answer is, can we test leaders about how they really create systemic change? And this is really forcing the medical community, the hospital community, all of the ancillary services to reconsider, what are our roles? How can we change that? Do we have to give up something? As a hospital, do I need to stop thinking about everybody gets inpatient care? And how do we start moving some of those patients that we're admitting to an outpatient system that's better designed, better equipped to handle the kind of issues that we're facing? The iceberg is also great for challenging your mental model. And when we talk about mental model, that's the window that you see the world. If you think about it, look at an aquarium and tropical fish. Do fish see water? No, but they see the world through the water they're in. And we see the world in the environment that we're in. And all too often we're bound by those parameters and obstacles that don't allow us to broaden our vision and really look at what we're trying to do. And then the last thing is, and we use this phrase over and over again in the book, is to provide a focus on results with meaning. That is, they have a real impact on care, and results that are meaningful, meaning that in the long term, you really have an opportunity to change what you're trying to do. We hope this is helpful. Use the iceberg. It's a great tool. Keep it handy for meetings. If you come up with a problem that you're facing, let's do a timeout. Let's spend a few minutes and explore and expand our thinking to try to uncover what's really going on. Good luck. We wish you all the best. We know it works.